It was just after 3 in the morning when the flashing blue lights reflected across the living room wall. The house was quiet. Too quiet. A 67-year-old man sat on the edge of his sofa, one hand on his chest, the other shaking slightly. He had always considered himself careful. He walked every day. He avoided junk food, and every morning, without fail, he swallowed 2 raw cloves of garlic. Because garlic was healthy. Everyone knew that. But that night, as the ambulance doors closed, one question echoed in his mind. How did something I trusted so much bring me here? If you're over 60, this story may feel uncomfortably close. Because what doctors are seeing today is something many seniors don't expect and almost no one talks about. Garlic isn't the villain. But after 60, the way your body responds to garlic changes, and the mistakes can be costly. Doctors across the US and UK are now quietly warning seniors. It's not about stopping garlic, it's about stopping these mistakes. Here's why. As we age, our bodies process food differently. Blood becomes more sensitive, the stomach lining becomes thinner, the liver and kidneys slow down just enough that powerful natural compounds, like those in garlic, don't behave the same way they did at 40. Yet many seniors increase their garlic intake, believing more is better. That's where the danger begins. The first mistake doctors see every week is taking raw garlic on an empty stomach. For younger people, this might cause mild discomfort. For seniors, it can lead to stomach irritation, acid reflux, dizziness, and even internal bleeding, especially when combined with daily medications. Doctors say they often hear the same sentence in emergency rooms. I thought natural meant safe. The second mistake is mixing garlic with blood-thinning medications without realizing garlic itself thins the blood. A little thinning can help circulation. Too much can cause bruising, nosebleeds, gums that bleed, or worse. After 60, even small changes in blood clotting matter. Doctors warn, garlic doesn't cancel medication, it compounds it. The third mistake is one many seniors don't even realize they're making, using garlic supplements without medical guidance. Garlic capsules are concentrated. One pill can equal several cloves. Doctors explain that supplements hit the bloodstream faster and harder, especially in older adults. That's why some seniors feel sudden weakness, lightheadedness, or heart rhythm changes without ever suspecting garlic. The fourth mistake is consuming garlic late at night. At night, digestion slows, blood pressure naturally drops. Garlic's active compounds can interfere with sleep, increase heartburn, and in some seniors, cause nighttime palpitations. Doctors often ask older patients with sleep problems one simple question: what are you eating for dinner? The fifth mistake may surprise you most. It's assuming garlic is always helpful, no matter your condition. After 60, garlic interacts differently if you have heart disease, diabetes, stomach ulcers, or kidney issues. What once supported health can quietly strain it if the timing, amount, or combination is wrong. This is where many seniors feel confused. Because for decades, garlic was praised. Grandparents recommended it. Articles celebrated it. So how can doctors now be warning against it? Here's the truth they want you to understand. Garlic is powerful medicine, and powerful medicine requires respect. Doctors aren't asking seniors to panic. They're asking them to pause, to listen, to notice subtle signs the body sends, like unusual bruising, persistent stomach discomfort, dizziness, or sudden fatigue. These aren't just aging. They're often signals. The senior from earlier learned this the hard way. At the hospital, his doctor didn't scold him. He didn't say garlic was bad. He simply said, at your age, your body needs balance, not extremes. That moment changed everything. Instead of blindly following habits, he learned to adjust, to reduce, to time his garlic properly, to communicate with his doctor instead of assuming. And his recovery began, not just physically, but mentally, because knowledge replaces fear. If you're over 60, here's what doctors want you to take away from this first warning. Garlic can still be part of a healthy life, but after 60, how you use it matters more than ever. Small mistakes don't feel dangerous at first, they feel harmless, until they aren't. In the next part, we'll uncover the remaining 5 garlic mistakes doctors say cause the most emergency visits, medication failures, and preventable health scares in seniors. These are the ones most people never connect to garlic until it's too late. So stay with us, because this knowledge isn't about giving something up, it's about protecting the life and independence you've worked so hard to keep. By the time most seniors hear this warning, the damage has often already begun. It doesn't arrive loudly. There's no sharp pain at first, no dramatic moment that tells you something is wrong. It arrives quietly. A little more fatigue than usual, a bruise that takes longer to fade, a night where your heart feels slightly off. And because you're over 60, you tell yourself the same thing millions of seniors do. This is just part of getting older. Doctors say that belief is one of the most dangerous mistakes of all. In hospitals and clinics across the US and UK, doctors are seeing a pattern. Seniors who believe they're doing everything right, eating clean, avoiding sugar, trusting natural remedies, are showing up with complications no one expected. And garlic keeps appearing in their stories. Not because garlic is bad, but because the last 5 mistakes are the ones that do the most hidden damage. The 6th mistake doctors warn about is using garlic as a replacement for prescribed medication. Some seniors slowly reduce their medicine when they start feeling better. They increase garlic instead, believing it's a safer, natural alternative. Doctors are clear on this. Garlic can support health, but it cannot replace heart medication, blood pressure drugs, or diabetes treatment. What happens instead is silent instability. Blood pressure fluctuates, blood sugar becomes unpredictable, and when symptoms return, they return harder. Doctors often hear, "I didn't want to be dependent on pills," but untreated conditions don't stay mild forever. The 7th mistake involves combining garlic with alcohol, even in small amounts. A glass of wine, a nightcap, something social. After 60, alcohol and garlic together can exaggerate blood-thinning effects, irritate the stomach lining, and disrupt sleep rhythms. Doctors say many nighttime falls and fainting episodes begin exactly this way, without the senior ever realizing garlic played a role. The 8th mistake involves overusing aged garlic extracts. They're marketed as gentle, refined, safer for seniors. But aged extracts are still concentrated. They still affect blood flow and liver processing, and seniors often take them daily for months without breaks. Doctors explain that the body needs rest, even from natural compounds. Constant exposure can lead to cumulative effects that don't show up until something tips the balance. The 9th mistake doctors find most troubling is ignoring early bleeding signs. Bleeding gums, frequent nosebleeds, tiny purple bruises on the arms. Seniors dismiss these as dryness, fragile skin, or minor accidents. Doctors say these are often the body's first warning that blood is too thin, and garlic, especially when combined with aspirin or anticoagulants, can push it too far. The 10th and final mistake happens in vulnerable moments, not adjusting garlic habits after surgery, illness, or injury. After procedures, the body needs stable clotting and predictable healing. Garlic interferes with that process. Doctors stress that many post-surgical complications could be avoided if seniors temporarily stopped garlic, but no one told them to, because garlic is seen as food, not medicine. This is the misunderstanding doctors are trying to correct. Garlic acts like a mild drug in the body, and drugs require timing, dosage, and awareness. Here's what doctors want seniors to do instead. First, communicate. Always mention garlic and supplements when discussing medications. Doctors can't account for what they don't know. Second, moderate. More garlic does not mean more protection. Often, it means more strain. Third, observe. Your body speaks quietly. Pay attention to changes in sleep, digestion, balance, and bruising. Fourth, pause when needed. During illness, surgery, or medication changes, garlic habits should change too. Doctors emphasize this is not about fear, it's about control. Seniors who adjust their garlic use properly often report better sleep, steadier energy, fewer stomach issues, and more consistent blood pressure readings. The goal isn't to remove garlic from your life. The goal is to stop letting it work against you. That 67-year-old senior from earlier, he didn't give up garlic. He learned how to use it wisely. Today, he walks without dizziness. He sleeps through the night, and most importantly, he understands his body again. That understanding is power. If you're over 60, remember this. Garlic is a tool, not a cure, not a substitute for care, not something to use blindly. Used correctly, it can support health. Used incorrectly, it can quietly erode it. If this message helped you, consider sharing it with someone over 60, especially someone who believes natural always means harmless. Because sometimes the most dangerous mistakes are the ones we never knew we were making. And awareness at any age can still change everything.